general principle is not curable.
I may begin by saying that breast cancer is one of the commonest cancers in Kenya today. When we look at the overall number of malignancies, both in men and women, breast cancer is still very high. We realize that we need to look into making an early diagnosis. Many of the patients in Kenya come late.
This rings true for one woman, 60-year-old Beatrice Samaki.
What did she say?
She says she's in the hospital because she has a problem with the breast.
Beatrice is to undergo a mastectomy to remove the tumour, thanks to the Surgical Society of Kenya, who annually perform free surgeries around the country. The Surgical Society have already performed 4 mastectomies, and Beatrice will be the last of the day. Now, the common factor with most of the patients is the very late stage of diagnosis, really highlighting the need for greater awareness in society.
This patient has a locally advanced cancer of the breast. Basically, the lump has been sort of neglected for some time, so it has grown until it has ulcerated. A good number of women come with late stage, either because of lack of awareness or because of a delay or lack of access to treatment. Yeah.
And whereas cancer has often been associated with the elderly, younger people are now battling the disease.
In our case, with the data from the Kenya Medical Research Institute and what we see, what would be called anecdotal, what we notice among our patient populations, our patients are young. Majority of our patients, 60 to 70%, are premenopausal. They are women still in their reproductive age groups. They are still breastfeeding their children. They are still looking after young children, and they are getting breast cancer.
31-year-old Flora knows this only too well.
I was diagnosed with breast cancer last year in July. That's when I found a lump in my left breast on my normal routine for a self-examination. I came to realize my left breast had a lump. But at that moment, I could not, I didn't take much initiative about it because I was in dilemma of, I was 2 weeks pregnant. So I was in the dilemma of aborting my baby and getting the treatment because I could not get chemotherapy. This is a really toxic drug on the growing fetus. Later, I decided to keep the pregnancy and I get the treatment later. It was a long story about it, but I managed later. When I delivered, is when again I got the treatment, which I'm on now.
It was a difficult and delicate decision to keep the pregnancy. Now she has a miracle to show for it, baby Marcus Miracle, so named for the delicate path that his mother walked.
I saw with her, you have to go into that.
Thankfully, Flora was diagnosed early, making the treatment more effective. I'm here at the Health Festival, organised by Iris Management, where several women have come for breast screening. Now, I myself will be having a breast examination. Screening is essential for women and men to have an early diagnosis, really highlighting the need for greater awareness and screening nationwide. Right, I think I'm ready for my examination. The sad reality is that effective nationwide screening and awareness is lacking. Even after diagnosis, the treatment options for women and men around the country are limited, with the Kenyatta National Hospital serving as the only public radiation facility to serve the country. This month of October, Kenyatta National Hospital is booking patients for radiotherapy for April next year. The government has outlined in its National Cancer Control Strategy 2011 to 2016 the necessary initiatives, but critics argue that implementation of the strategy is what will define how the country manages the disease. Michelle Morgan reporting for Citizen News.